My name's Robert Justice. I'm married, my wife of 30 years, 3 children, ages 31, 27, and 24. On August 12th of 2020, I was diagnosed with a tumor in my pancreas. This is the day change your life. The symptoms I really was feeling was I noticed I was losing weight. I was turning yellow, I was itching, and come find out later that's all signs of liver problems. At Prisma Health, they identified they had the tumor. They referred me to Dr. Clanton, and he sent me and my wife and my oldest daughter down and basically kind of explained that, this is a very serious condition. There was a, good chance, 20% chance I would not survive the surgery.
Fortunately for Mr. Justice, he sought medical attention, and they did find that mass in the pancreas early, and they sent him to me in my surgical oncology clinic. Once I saw him, we discussed all the different options and decided that the best thing for him was to proceed with surgery so that we could remove this mass. He underwent a Whipple procedure, which is a major surgery where we remove part of the pancreas, part of the stomach and small intestine, part of the bile duct, and even the gallbladder. Mr. Justice recovered very well from this, and he was home within a matter of days and eating and drinking normally and not having much pain at all, and was able to recover and move on to the next portion of his treatment, which meant chemotherapy for this cancer.
I went through chemotherapy for 6 months, and they recommended going through 32 radiation treatments along with chemo pills. So that was about another 3 or 4 months. So overall, it took about 1 year from the diagnosis, the surgery, recovery from the surgery, the chemo and the radiation. And I'm feeling great now, getting real good diagnostics back. Cancer right now is gone. I do periodic scans to make sure nothing else is coming back.
Prior to the Division of Surgical Oncology and myself being here in the Columbia region, most patients with pancreas cancer, in order to get treatment, especially surgery, had to travel far away, hours and hours away, potentially even out of state. But now I'm happy to say that patients in the Columbia area and the surrounding communities can stay close to their friends and family and loved ones while getting exceptional cancer care. It's so important for patients who have complex cancers like this, cancers of the liver or pancreas, to not just have a surgeon like myself who's experienced in the care of these cancers, but it really takes an entire team. And I'm very proud that we have significant expertise, whether it comes to oncology, whether it comes to the nursing care that the patients receive either in the office or when they're recovering in the hospital. We have great gastroenterologists, we have nutritionists that see the patient both inpatient and outpatient, and really a whole team that comes together to offer whatever the patient needs at that individual time.
I can't say enough good things about Prisma Health Richland and Dr. Jesse Clanton and his team. They did a fantastic job. This was in the fall of 2020, could not have visitors, and so they really made it good for me, and they did a really good job too of keeping my wife updated on what was going on with me, so she wasn't so worried about it. I would not be here today if it was not for the folks at Prisma Health Richland. I would have been passed away months ago and would not be here now for my daughter's wedding. They gave me life-saving surgery, and I'll never forget it.